Hi, my name is Heather, and I am a therapist and a clinical supervisor at KidStuff. And I want to give you some information about what to expect if your child is receiving therapy while you are either going through a divorce or a custody dispute. So, the first thing to know is whether or not you have access to the information. If you have 50-50 decision making or you are the sole decision maker, you have access to the information. If you don't, whoever does have decision making would have to sign a release to give you authorization to have whatever access to whatever information they feel like is appropriate. Also, if your child is 12 years old or older, in the state of Colorado, they become in charge of their own therapy. So they would have to sign a release for parents to have access to the information. The second thing is what is appropriate to ask for. And when we talk about appropriate, what I mean is the information that is going to help versus hinder your child's progress in therapy. And this is all general information. So themes. This is kind of the bird's eye view of what your child is processing in therapy. Another thing is treatment plans. Treatment plans are the goals and objectives that we come up with to guide therapy, to guide what we're working on in session. And then treatment summaries. Treatment summaries are kind of the overall everything that's going on in therapy in a very general sense. The reason we keep things general is to, again, preserve that therapeutic relationship and preserve that progress that's being made in session. Themes and treatment summaries, depending on how fast your child is making progress, we may feel it's appropriate to send those out every 3 to 6 months or every 6 months to a year. It really just depends on how sessions are going. And it's most important to ask the clinician that you're working with what they recommend as far as how often to send those out. The other one is the treatment plan, and that we update once every 6 months, so it would be appropriate to ask for that about once every 6 months. Again, we provide very general information. The caveat to that is if your child has a safety concern. If there is a safety concern, we're very specific about that, and we make sure everybody's on the same page as much as possible in order to keep your child safe. If you have any other questions, please feel free to reach out to us. If not, thank you so much and have a great day.